Who determines which health care provider the state employees have as a choice?
That would be the Department of Human Resource Management, or DHRM for short. Their Office of State Benefits administers the state employee insurance plan.
Are all insurance provider benefits the same?
No, the state plan offers CovaCare and CovaConnect, which are available statewide. CovaCare is administered by Anthem, and CovaConnect is administered by Optima Health. Both plans offer buy-ups for additional dental, vision, hearing, and out-of-network coverage. For employees who reside in Northern Virginia, there is Kaiser Permanente HMO coverage.
Who determines the state and employees' portions of health insurance payments for each plan?
The Commonwealth's benefits plan is a self-insured plan, which means that we pay our own claims. And DHRM sets the monthly premium cost based on the claim expenses and the state's budget. And then the General Assembly reviews and approves the cost annually during the legislative session.
Do the agencies have any influence on the provider selected or the cost to state employees?
No, the components of the health care plan are determined by DHRM's Office of Health Benefits and the General Assembly.
I keep hearing about the open enrollment period. What is the open enrollment and why is it important?
Open enrollment is the time between mid-April and mid-May each year when we're able to make changes to our health plan elections. You can change your membership status, you can add and drop dependents without meeting the mid-year qualifying events. And it's also the time to sign up for flexible spending accounts for the upcoming year, such as medical and dependent care reimbursement.
If I make a change during open enrollment, when is it effective?
Changes made during open enrollment are effective on July 1st, and if that change impacts your cost, then you'll see the change in your July 16th paycheck.
Why is it important to keep my personal address up to date?
It's important to keep your address up to date because your health care provider pulls your current address from the benefits eligibility system when there's a need to mail out any communication or an explanation of benefit statement to you at your home. For example, every spring during open enrollment, DHRM mails a health benefits spotlight newsletter out to all employees. This spotlight highlights plan changes and any new benefits that are being introduced that year. This is a very important mailing, and having a current address in the system is essential.
What if I need to make a change to my health insurance out of the open enrollment period?
If you have a qualifying event such as the birth of a child, marriage, divorce, etc., you have 60 days from the event date to make the change. Failure to meet the 60-day time frame removes your opportunity to make the change until the next open enrollment period.
What documents do I need to provide when adding a dependent to my health insurance?
To add a dependent, there are certain documents that you have to provide. To add a spouse, you have to provide your marriage certificate and the first page of your federal tax return. If you want to add a child, you have to provide their birth certificate. And if you want to add a stepchild, you have to provide a marriage certificate between the employee and the stepchild's parent. The child's birth certificate is also required, as well as the first page of the federal tax return showing that the parents filed the taxes together.
What is Employee Direct?
Employee Direct is a secure automated system that allows employees to review their current plan selection, their dependents enrolled in the plan, and make changes to the plan either during open enrollment or if they have a qualifying event. And the web address for Employee Direct is www.edirect.virginia.gov.
Provider says they pay based on their allowable charge rate. What is this?
The allowable charge is the amount that the health plan will reimburse for a specific service. This is also the amount on which the deductible, the copayment, or the co-insurance is based.
How are my health care premiums paid?
Your monthly premium is split into semi-monthly payments and is deducted before taxes and taken out each pay period.
What am I required to pay a doctor or a facility?
You must pay your copayment, if there is one, directly to the treating doctor or facility. They will bill your health insurance. Then your insurance will pay the allowable charge and send you an explanation of benefits, which will show what their allowable charge was and what they paid. It should also show any copayment that you're responsible for and what your remaining balance may be. There are yearly deductibles and out-of-pocket limits that factor in as well.
Am I responsible for the difference between the actual cost and the allowable charge?
You would be responsible for the difference between the actual cost and the allowable charge if you went to a facility or a doctor that's out of network and you don't have the out-of-network coverage. You could be balance billed for the difference. To make sure that your doctor is in network, you can visit your insurance company's website, or you can call the insurance company and ask. Their phone numbers are on the back of your insurance card, or you can call the doctor or facility directly and ask them.
What happens if I don't have out-of-network and go to a hospital or a doctor who doesn't accept my insurance?
If you receive medical treatment from a hospital or a doctor who doesn't accept your insurance and you don't have the out-of-network benefit, you would be responsible for the full cost. The only exception is for emergency services. If you are rushed to a hospital with a life-threatening emergency, those emergency services would be covered.
Do I have out-of-state benefits?
Yes, as long as you go to a facility or a doctor that is in your network or have the out-of-network coverage.
Where can I find out more details about my health care insurance?
You can Google VDOT benefits to get a link to all our insurance providers' websites and plan handbooks. You may also contact your district human resources.
What is a deductible?
Deductible applies to services such as diagnostic tests and is the amount that you're required to pay each plan year before your insurance will pay for those additional services. The allowable charge amount for those services is applied to your deductible until you meet it. Your dental coverage has a separate deductible.
How long can I keep my children on my insurance?
You can keep a child on your insurance until the end of the year that they turn 26. Disabled dependents may remain on your insurance, but you must go through a qualification process through DHRM's Office of Health Benefits. Your member handbook has the instructions.
What about a divorced spouse?
Your ex-spouse needs to be removed from your health insurance at the time the judge has signed the final divorce decree. You have 60 days from the date of the divorce to drop your ex-spouse from your plan. Their coverage would end the last day of the month that the divorce was final. Your ex-spouse will be offered extended coverage, COBRA, as required by federal law.
We hope you find this information helpful. Don't forget that you can Google VDOT benefits for the website that has additional benefits information. You can also contact your local benefits administrator.